Hi, thanks for coming into Forest Road Dental today. As promised, a small video to complement your appointment today on your oral hygiene. So I'm going to start off with the basics. Toothbrushing. Don't mind what you use, electric one or a manual one, as long as you use a toothbrush twice a day and interdental products once a day, fantastic. When we clean our teeth, we always need to make sure that we are angling down towards the gum line here. This is where the plaque will sit, the bacteria will sit. It's soft and sticky, so we need to make sure that we're applying certain pressures to get rid of all the bacteria. We also need to make sure that when we're using the toothbrush is that we're angling it down towards 45-degree angle. Okay, so with the electric one, turn it on, angle it down into that area there. Let me see if I can just help that a little bit more actually, so we can do it like that. Angling it down in towards that gum line there. Same on the other side, angle all the way down. Same on the outside, angle down towards the gum line. Keeping all the way around, so you're actually making sure that you clean all of the teeth. It's exactly the same with the manual one, just means you have to work a little bit harder. Angle down in towards the gum line, give it a lovely massage round, and then flick up. Angle down towards the gum line and flick on up. You can see how the little bristles are actually getting in between there. Okay, same as on the inside, angle down in towards the gum line and flick up on the other side there as well. Okay, up. Inside where your tongue is the most difficult bit, and the plaque is really soft and sticky. So how about feel around with your tongue, and if it feels rough, it means that you've not cleaned it off. So go back in and give it another good clean with either of your toothbrushes. What you can also use is this little gadget here called an end tufted. Absolutely love this brush. And this brush will help you to get, again, on the insides, angling down towards the gum line, really push that little brush all the way into the gum. Let's see if I can show it better on down here. Like that, okay. You can also use it for those areas where you feel you've got a bit of a deeper pocket. Angle your brush down in towards the gum line. It's always that 40 to 45-degree angle, and getting in and giving a really good clean. Can you see how that bristle brush is getting in there? Don't be scared to get it down underneath that gum line, okay? That's what its job is to do. You must be getting underneath there. The bacteria that's causing your pocketing is underneath the gum. So you need to get your bristles from your toothbrush, your untufted brush, or any of your interdental cleaning products into that area there. Disturb the biofilm, the matrix that's down there, get it all out, okay? So once you've done your brushing, we need to move on to interdental cleaning. Now, you can use floss, and you wrap your floss around your middle fingers. You use your index fingers on the top and your thumbs underneath, and then you can sort of wiggle it around as you need it, okay? When you come to do the teeth, let's see, point the floss down in towards the gum line, splay it around the tooth like a C shape, okay? And then what you're doing is you're coming up like that. Go on to the other side of the other tooth and come up and down like that, okay? So therefore, you've done those two. Wrap the floss around your other finger, so you've got another clean bit again, and onto another tooth. Again, the same sort of angle. Angle down towards the gum line, splay it around like a C shape, up and down again, and then again here, up and down again. Okay. Lots of you don't like using floss. I don't blame you. It's a bit tricky. So we can use either TPs or Wisdoms. Okay. You know from when I've done TPs with you. There's always a load of colours, and I always try and measure you up to find the right one, okay? I'm just going to use the pink one. So take the cap off. You can use the cap as a handle. That works really, really well. Take your interdental brush, take it in between, and literally right the way onto the gum line there, because this is what we're doing, is push it back and forth onto one side there, and then onto the other side there, okay? Not just one action, in and out, that won't work. Remember, it's sticky stuff. We need it several times around that area. Now, sometimes we need to go a little bit deeper, so you need to do a bit of a vertical clean, because underneath here is where the root is, and this is where you've got the deeper pockets on some of the teeth that I've probably already pointed out to you anyway. So take your little brush, take it down, so you're actually going down, that's right, down into the gum line, and give it a really good clean. Now at this point, you might notice that the gum might start to pour with blood. Do not panic. This is because you're getting to the area where the infection is. Super, super important. The more it bleeds, the more you clean it. Okay, get in there and give it a jolly good clean. I know will have measured them up before, so use the colour that I've shown you before. So blues, yellows, you know, whatever. Get down there and give it a good clean. If you have problems going vertically with that one, give me a ring, let me know, and I'll point you in the right direction, okay? What you can also use around these deeper pockets is this guy again, remember, angle down, push him down so it goes right underneath that gum line and push down. Again, you might get more bleeding around there. Doesn't matter, keep getting in there and cleaning it. What you also can use as well is on these little brushes is some Corsadil gel. Don't use too much, so just put a little bit out, maybe put it onto your hand, roll the TP in the area itself, so you've got some onto the brush, and then push it where you need to be pushing it, so where are the lower ones here, yeah. So back and forth, and also down into the pocket, okay, and then just spit out after that. Leave that gel in there to do the work that it needs to do. You can use the Wisdom ones as well. I know that we stock these in the surgery too. I think they come in 3 colours, blue, green and purple. These are these gadgets here. A little bit different to the TPs, as TPs is a brush and these are like a rubber thing. Exactly the same, pushing in between like that, okay. And again, like that. Again, you can use some little gel on it, pop it in between again, okay. What I also think is a great idea is using a tongue scraper. I know some of you might not like that idea, but it's amazing what you can get off. You've got some little serrated edges here, and these are the edges that you use on the tongue, so pretend my hand is the tongue. Towards the back of the mouth, scrape down in nice movements, okay. Wash it underneath the tap and do it again. You'll be surprised how much you can get off. Fantastic, just leave it to dry after that. If you want to use a mouthwash, you can do. I know in the past that I will have recommended certain ones for certain amounts of time. If you just want to use a normal generic one, like a Listerine one for this time being, you can do. Just make sure it's alcohol free. And I know that they do quite a range of that. I know that I have said to use Peroxyl before in the past to some of you. Remember, it's a short-term mouthwash, so 7 to 10 days. Obviously, don't use it if you start to have any problems. That too is also a good mouthwash. You can use the Corsadil daily. Again, there is a time limit on that. I think it's something like 6 weeks, but you'll just have to have a look on the back of the packet. I've not got one here at this moment in time. But remember that you will probably get some staining from that, and you might get some staining from the Corsadil gel as well. Do not panic about this. When I see you again, I will go around with the ultrasonic and I will clean it all off for you, and you will have sparkly teeth yet again. So please don't panic about that. My main thing is to make sure that we're keeping these gums nice and healthy, okay? If you have any problems with what I've shown you today, or you can't get hold of any of the products, give the girls a ring on reception. They can advise you what to do, and they can also leave me a message and I will get back to you. That is not a problem at all. Please do so. And I will see you in a couple of months' time. Hopefully a little bit of more normality, have a bit of a chat. And until then, please keep brushing.